paid attention to your Medicare, now is the time. If you're over age 65, this is 2025, and the Medicare Annual Enrollment Period starts on October 15th, goes to December 7th. You can make changes, but this is going to be the biggest year of change for people that are over 65 on Medicare, traditional Medicare, Medicare Advantage, Medicare supplement plans. This is the year you need to pay attention because late life healthcare costs are not going down, they're going up. There is a spread cost benefit. So if you can't afford to pay for your portion of your Part D expenses, you can spread those things out during the year, $112 per month. The Part D cap, which was $2,000, is going to $2,100. They're going to limit chronic care payments for supplemental benefits under Medicare Advantage plans. Next, there is an insulin cap of $35. That's going to be the same for those folks that are on insulin, that have diabetes. This is a big win for them. There's going to be a 6-state pre-approved authorization. This is brand new. Now, we've never had under traditional Medicare pre-authorization approvals, but in 6 different states, they're going to be requiring pre-authorization for certain procedures under Medicare. That all sounds fine. It's going to be an inconvenience. It doesn't necessarily mean you're not going to get the benefits, but this is the year where if you're going to have serious work done and you live in these certain 6 states, then you're going to need to get prior authorizations. Also, there's a zero cost for adult vaccines. That's all great. If you can get vaccines, they will be at zero cost. So these are the 6 things that are usually advertised as the changes to Medicare. But I'm going to give you my 6. The Medicare changes as a part of the OBBA bill means there's going to be about a $10 billion cut in funding for Medicare. Next, there's going to be less plans and less options for sure. Many of you following the issues with certain Medicare Advantage providers like United Healthcare and others, you're going to find less plans in your zip code. Next, there's going to be a lot less help for home health care. There's 2 big cuts that have been put in. Some home health care services are provided by Medicare, and therefore they're also provided by Medicare Advantage. However, CMS has approved a 6.5% cut in benefits. Not going to be easy because it was already tough to get home health care people to come and service your home health care needs if you need them. It's going to be even harder now to get that. There's going to be a serious change in how Medicare is delivered to people in certain states, especially if you're a dual qualified person. If you're on Medicare and Medicaid, the 11 million people that are going to be getting reduced Medicaid benefits are going to be seriously impacted on this. Now remember, Medicaid's a federal program, but it's administered by state governors. So a lot of this has to do with the luck of where you live. When this annual enrollment period called the AEP begins, you need to pay a lot of attention to what's going to happen in the state that you live in. So if you were ever going to pay attention to your Medicare coverage, you should pay attention in this particular year, especially if you're preparing for major health costs like knee replacements, hip replacements, things that you've been waiting to schedule, and you might want to make a change to your plan this year. Remember, there's no pre-existing condition clauses for moving. So even if your doctor told you you need hips or you need knees or something like that, this is going to be the year to pay attention to which plan that you should have to sort of game the system and get the best benefit you can. There is no law against gaming the system. You can go to a more expensive plan, get your things paid for with maybe less out of pocket or a lower cap, and that's all great. It doesn't mean you can't go back after you have these services done to a less expensive plan in the annual enrollment for 2026. Remember, what you're enrolling for now, when you make your change for annual enrollment period, it's going to be in effect January 1 of 2026 for the year. Let's plan ahead. We don't want to see people get hurt by surprises on their Medicare. Every person that's on Medicare, this is the year that you should reach out and get some help. Now, also, I want to point out, we have a lot of our senior citizens doing travel. Make sure you have very substantial foreign travel coverage. The experience in our firm is that a lot of people who travel a lot during their retirement aren't aware of how much it can cost if you have a health event outside the United States and you're cruising in Italy or somewhere else. Think seriously on those trips to buying the type of coverage that you can buy for 1 year at a time. It's not a lifetime commitment. You can buy not only foreign travel coverage, you can also buy things like air evacuation if you need to get picked up by a helicopter and flown off of the tail of some cruise ship. Let's do it now before you get into a situation in 2026 where you have claims outside the country that are not paid for under your Medicare plan. Late life healthcare cost is part of wealth management. And so we don't want to see unplanned late life healthcare expense dig into your retirement savings. So paying attention to the amount of money that you're going to pay this year for out-of-pocket expenses for your healthcare needs is just part of the art of being smart.